Assalamualaikum warahmatullahi wabarakatuh. So today, dear students, I am entitled to give you lecture for pathology subject, which is on circulatory disturbances. So as you've all known, I've already emailed the lecture slides, which is circulatory disturbances 1 and also circulatory disturbances 2. I divided it into two PowerPoint slides as there are about like 8 circulatory disturbances that you guys have to know under this topic. So I've divided like 4 topics into one PowerPoint slides and the other 4 into another PowerPoint slides. I am sorry I can't be there physically in the classroom to give this lecture, as currently I am heavily pregnant and just waiting the certain moment for the delivery of my baby. So therefore I'm giving this lecture through this video. So in case you guys have any questions of this, you guys can just message me or email me regarding about this topic. So let's start with the PowerPoint slides for lecture circulatory disturbances 1. So under the circulatory disturbances, there are 8 pathological disease that you guys need to know. So what happens is that there's disturbances that happens in the circulation, where if you could see on your PowerPoint slides, the disturbances of circulation, where circulation is the mechanism of distribution and return of blood to and from tissues in a manner of circular movement. Okay, so there are some important disturbances that are generally known, which is the hyperemia, the edema, the shock, thrombosis, embolism, and also infarction. Okay, so circulatory disturbances, it happens when there's disturbances that occurs in the blood system, in the body fluids, So we know that in our body system we have normal fluid hemostasis. Okay, and if there's anything that disturb the circulation system, it's known as circulatory disturbances. So for circulatory disturbances 1, there are 4 circulatory disturbances that has been listed in the PowerPoint slides, which is hyperemia, thrombosis, embolism, and also ischemia. So let's look at hyperemia. So if you could look into your lecture slides, hyperemia is the disturbance in the volume of circulating blood, which is it is an increase in the amount of blood within the vessels caused by dilation of the microcirculation. And this hyperemia is divided into 2 types, which is active and also passive. So if you can see on your in your lecture slide, on the 5th lecture slide, there's a picture of conjunctiva. It's one of the eye disease that occurs in the eye. So we could see that there's hyperemia going on, where there's the congestion of blood vessels, and that also causes redness, okay, to the eye, and it causes conjunctiva. So it means that there's a disturbance in the volume of the blood that is circulating. Yeah. So for active hyperemia, it means that there is excess of blood in body part that caused by vasodilation. And there are 2 types, which is physiological and also pathological. So physiological is in muscular exercise. It causes flushing skin of the face, menopausal flush, and in pathological, it occurs in acute inflammation and also in a high-grade fever. Okay, so it means that there's excess of blood in our body part, which is caused by vasodilation. That is for active hyperemia. And there's another type of hyperemia, which is the passive hyperemia. It means that there is excess of blood in the body part caused by vasodilation that follow the obstruction of venous, which is also called congestion. And for passive hyperemia, there are 2 types. We have the systemic venous congestion and also the local venous congestion. So in slide number 7, you could see there's a passive hyperemia for venous congestion, where in the diagram you could see that there's a right side heart failure and also there's a left side heart failure. So in the right side heart failure, there is a systemic venous congestion with sparing of the lung, while in congestive heart failure, in both sides, I mean the left and right, there is congestion of all organs including the lung. For left side heart failure, there is the pulmonary venous congestion, but later it may cause to the pulmonary hypertension leading to the right side heart failure. For example, the congestive heart failure. Okay, so for passive hyperemia, it is the excess of blood in body part caused by vasodilation, and it also causes congestion, which then may lead to heart failure. Okay, which then may lead to heart failure in the right. This congestion can lead to heart failure in the right and left heart. Okay, so passive hyperemia is also known as venous congestion. So we have the systemic venous congestion and also the local venous congestion. Okay, so for systemic venous congestion, is the congestion of the systemic veins. For example, in the left side and also in the right side, heart failure and also lung disease, which interfere with the pulmonary blood flow. So that's the systemic venous congestion. It means it's the congestion of the systemic veins in the left side and also right side heart failure. Okay, that's what we call as there's like a congestion, obstruction. So for systemic venous congestion, the general effects is cyanosis. Okay, cyanosis, it means that the affected tissue or organ is in bluish in color, which we call cyanosis. So you could see in the slide there's a picture of hands and the fingers, and there's the bluish colors on the fingers, so that's called cyanosis. And why there's cyanosis, this blue color on the fingers of the hands, is because it's due to the red cell stasis and also accumulation of deoxygenated hemoglobin. Okay, so we call it as bluish in color, cyanosis. So that's one of the general effects for the systemic venous congestion. I mean, for the congestion of the veins. For the systemic venous congestion, there's also the local effects. I mean, for pulmonary venous congestion, if you could see on the slides, there's left heart failure. When the left side of the heart fails, it causes congestion of the pulmonary circulation. Okay, acute congestion causes dilation of the alveolar capillaries with transduction of fluid into the alveoli. And then there's the chronic congestion, okay, which increase in the pulmonary venous pressure stimulates the development of fibrosis in the alveolar walls. So these are all the local effects for the pulmonary venous congestion. And then there's also the hepatic venous congestion, where the right heart failure causes congestion of the systemic circulation, and that it will cause the peripheral edema of the ankle, dilation of the central hepatic veins, and also congestion of the sinusoids in the central part of the hepatic lobule. And in this increased congestion causes to hypoxia. Okay, it means not enough of oxygen. Okay, causes hypoxia, which then will reduce the blood flow. There will be fatty change of liver cells, and this will enhance the mottled appearance. Okay, so it means that all of these, that's why one of the general effects is cyanosis. Okay, because it leads to hypoxia, and cyanosis is a sign that there is deoxygenated hemoglobin. Okay, so that's the first disease for under the circulatory disturbances, which is hyperemia. It means that there's a disturbance that occurs in the volume of circulating blood in the human body. So the next one is thrombosis. Okay, and I think this is a common disease that students might well know, because you know, is thrombus. Thrombus is the final product of blood clotting or blood coagulation. And thrombus is formed from blood constituents, which are the platelets, the fibrin, entrapped red and also white blood cells. And thrombus is actually normal in cases of injury, but pathologic in instances of thrombosis. So you could see in the slide that there's a picture of thrombus. Okay, so you could see that there's a blood vessel, and then there's thrombus. The red is in the slide number 13. So you could see that there's a red product there in the blood vessel, and this thrombus is made up of platelets, fibrin, and also trapped red blood cells. Okay, so thrombus is actually the final product of blood coagulation or clotting. So it's actually normal in cases of injury. You know, when people are injured, there will be some bleeding, and then there will be some processes of blood clotting. So it's it's actually normal in cases of injury. But maybe in pathologically, there will be some thrombosis. We'll see what's thrombosis. Okay, that's thrombus. So what is actually thrombosis? So thrombosis is the formation of a solid mass, that solid mass which we call as thrombus before, inside a blood vessel, and it obstructs the flow of blood through the circulatory. So it means it obstructs the blood flow through the circulatory, so it causes circulatory disturbances. Okay, so that's why thrombosis is one of the pathological disease under circulatory disturbances, because it disturbs the circulatory system. Okay, so that's thrombosis. So if you could see, there's a picture on lecture slide number 14 about deep vein thrombosis. Okay, so there's the deep veins of the leg. So we could see that there's one picture of the normal blood flow. So there's blood flowing through the blood vessel, and then there's another picture of the deep vein thrombosis. Means that we could see there's blood flowing, but then there's a formation of a thrombus product. Yeah, we could see that this red there's gumpalan warna merah ini, the product gumpalan merah, this red gumpalan merah ni is actually the formation of thrombus, and it's obstructing the flow of blood inside a blood vessel through the circulatory system. So this is one example of a thrombosis that happens in the deep veins of the leg. There's another picture. The third picture is showing there's a thrombosis, and there's also an embolus. But we will go into that embolus under the topic of embolism, so don't worry, we will go into that part. But currently we're under the topic of thrombosis, so we'll just stick to the thrombosis part. So abnormal hemostasis. So abnormal hemostasis is a disturbance in the normal balance between thrombus formation and also dissolution, which is the fibrinolysis. Excessive thrombus formation, okay, it causes the narrowing or occlusion of the vessel lumen, and you could see in a picture in this slide number 15. There's formation of thrombin in the blood vessel, and if the formation of this thrombus is excessive, it's a big product of thrombus, it causes the narrowing of the vessel lumen, and at the same time it will obstruct the flow of blood through the blood vessel. So So this will cause abnormal hemostasis. Okay. And this excessive thrombus formation is also a disturbance in the normal balance between the thrombus formation and also the dissolution, which is the fibrinolysis. So it causes abnormal hemostasis. Okay, factors in thrombus formation. Endothelial damage, one of the factor in the formation of thrombus, which is the endothelial damage, because endothelial damage, it stimulates both platelet addition and activation of the coagulation cascade, and it frequently it is the dominating factors that initiate thrombosis in the arterial circulation, and it makes the endothelial damage less conspicuous. So this is one of the factors that causes the formation of the thrombus, which is the damage of the endothelial. Okay. So when the endothelial is damaged, it will initiate the formation of thrombosis. Okay, especially in the artery, which is in the arterial circulation. It will cause the product of thrombosis, formation of thrombosis. The second factor is changes in blood flow. So decrease in blood flow and turbulence are more important factors in venous thrombosis. And the third one is change in the blood composition. So changes such as increased viscosity, increased fibrinogen levels, increase in platelet numbers. These are also the factors that play important roles in the formation of a thrombus. So if you could see in lecture slide number 18. So the definition of thrombosis is the formation of a blood clot, which is the thrombus product in an uninjured vessels, or thrombotic occlusion of a vessel after a minor injury. And the thrombus is formed of blood elements, like we talked before, like platelets, trapped red blood cells, trapped white blood cells, and it develops inside the cardiovascular system during human life. So there are three types of thrombi. Actually, there's the pale thrombus, the red thrombus, and also the mixed thrombus. So a pale thrombus, in a flowing blood, a pale thrombus, it occurs in a flowing blood, such as in the cardiac chambers, in the arteries. And pale thrombus, they are formed mainly of platelets. And they looked firm, pale, reddish grey. That's the likes of the look for the pale thrombus. For the red thrombus, it occurs in a stagnant blood. It is formed of fibrin entrapping red blood cells, leukocytes, and also platelets. It looks as soft, dark red, and gelatinous. That's the red thrombus. For the mixed thrombus, it occurs in a slowly flowing blood, usually in the veins and also in the arteries, and is formed of layers of platelets and fibrin entrapping red blood cells and also leukocytes. And the looks of it, it's alternating red and pale layers. Okay, so there are these three types of thrombi, or three types of thrombus formation or thrombus product that occurs. Okay, so we have pale thrombus, red thrombus, and also mixed thrombus. Okay, we have also sites of thrombus. Sites of thrombus where the blood clot product happens. So there are actually two sites of thrombus, which is the arterial thrombosis and also the cardiac thrombosis. Okay, for the arterial thrombosis, the affected area is the large and medium-sized arteries, which are the aorta, carotid arteries, coronary arteries, arteries of the intestine and limbs. I mean, if you hear arterial thrombosis, just remember that it happens in arteries. It happens in large and also medium-sized arteries. And arterial thrombosis, it usually occurs after the endothelial damage and also local turbulence, which is caused by atherosclerosis. So there's a picture here in slide number 19 for arterial thrombosis, which happens, and this arterial thrombosis happens at the arteries of the leg. So we could see that, okay, the first one shows the normal blood flow through a blood vessel, and then we could see there's arterial thrombosis. It means that in this artery of the leg, there's a product of thrombus. So we could see here there's a product of thrombus. So we could see that there's an obstruction. When there's the product of thrombus in the artery, it means that there will be an obstruction of blood flow in the arteries. So this is one example of which is called the arterial thrombosis. It means that there's the formation of thrombus going on in the arteries. So another side of thrombus is the cardiac thrombosis. It means that thrombus that form within the chamber of the heart. There are a few causes that causes this cardiac thrombosis. Two of the causes are inflammation of cardiac valve and also damage to the mural endocardium. So in slide number 20, there's a picture of the heart. Okay, so we know in the heart there's right coronary artery, there's left main coronary artery. Okay, so we could see that there's a picture of a thrombosis. It means that there's a formation of the thrombus product, okay, through vessel within the blood system. Okay, so it means that cardiac thrombosis is that there's the formation of the blood clot product, which is a thrombus that forms within the chamber of the heart. Okay, and this may lead to, like I said, usually the thrombus product, it will cause obstruction of the blood flow, and later it could lead to lots of certain causes such as heart failure, shock. There's lots of later stage that it may lead to this thrombosis. So two of the causes of the cardiac thrombosis is the inflammation of the cardiac valve. So we could see that endocardial damages caused by inflammation of the cardiac valve, and it leads to so one of the name of inflammation of the cardiac valve we call is endocarditis. So endocarditis is an infection or inflammation of the inner lining of the heart, particularly the heart valves. It's endocarditis. So so in this slide we could see that there's a picture of endocarditis. So there's the picture of the normal aortic valve, and then there's the area of infection on the aortic valve. So that infection, we call it as endocarditis. Another cause for cardiac thrombosis is damage to mural endocardium. Now, mural endocardium is the posterior wall of atrium. Okay, so it's caused by myocardial infarction and also ventricular aneurysms. Thrombi, they formed on the walls of the endocardium, which is the posterior wall of the atrium. So this thrombus product, it forms on the walls, and they are often large, and it can also give rise to emboli. Okay, emboli is also another product that we will learn under the topic of embolism, which is then our next topic after this is embolism. But before I continue, I would just like to take a few minutes break because I just need to drink some water. Thank you. I'll be back.